Every week we've been having a doctor join us to answer your questions about COVID-19. And this week we spoke with the Chief Clinical Officer at Hartford Healthcare. Channel 3's Kara Sunland has more.
Here's one of the questions we get a lot. At what point, after a person is exposed to the COVID virus, is that person likely contagious? Does the virus have to be in the body incubating for a certain period of time?
Yeah, so generally the virus can be transmitted. The individual can be contagious for up to 14 days after the initial exposure. Usually, the period of significant contagiousness is in the first early 5 to 7 days, but it can extend up to 14 days. That's why we recommend 14 days of quarantine for anybody who's been exposed.
All right, and who also is eligible to donate plasma, which has been shown anecdotally to help some patients recover? For instance, would you disqualify someone who has recovered from COVID from donating plasma?
Generally, most people who have recovered from COVID and 14-day period has passed will qualify for that. There are certain circumstances where I think the discussion with the primary care physician, the physicians would be helpful because certain condition will disqualify largely. It's the right thing to do. It's a wonderful therapy for our COVID patients, and most patients will qualify for that.
Okay, and as we look toward the fall, are we in any better position to battle COVID if we're unlucky enough to get the virus than the patients who had it early on?
Yeah, so I think it's a great question. So we're still learning, as you know, the science is still evolving on the COVID front. We've come a long way since early stages. Obviously, we have noticed that the therapies right now, we understand them better to a certain extent. We have remdesivir, we have tocilizumab, we are using dexamethasone. We have convalescent plasma, which we didn't have in the early February and March. So we are definitely better positioned than we were in March. And I'm hoping some of the therapeutic trials which are going on right now, by fall, we would have a better understanding and we would be in a much better position. The biggest hope we have is the vaccines, and the vaccines will provide a significant amount of protection, and our goal should be to reduce the disease burden in the community and the society. Now, that still will take some time,
right?
But we are definitely in a better position. Are we out and clear? We are not. There's no treatment we have found which completely treats it at the moment. There are a combination of things to reduce the mortality, duration,
right,
reduce the severity at the moment.
But no cure as we know right now. So Dr. Kumar, I know you're going to be back with us in our next half hour to answer some more questions. Thank you so much.